All right. Well, thank you all for joining us today. I'm your host, Nicole Henderson. Thank you all for being here again. I'm the communications director at Progress, Georgia. Today we are joined by the 9 to 5 Coalition and Friends on the Paid Family and Medical Leave Act that was signed yesterday, HB 1010. And we want to discuss today what that means for Georgians. But before we get started, just a little bit of housekeeping. Following today's press conference, we will have a question and answer session. Some of you all will be watching this via the recording. Feel free to contact me if you have any additional questions or the names listed on the press release. Final reminder, you all are able to use this shared content for your news content with attribution to the appropriate speakers. And with that, let's get started. Jasmine Bowles is going to kick us off. Jasmine, I'll turn it over to you.
Thanks, Nicole. Good afternoon, y'all. So glad to be with you. My name is Jasmine Bowles, and I am the Executive State Director of 9 to 5 Georgia. We are a membership organization dedicated to achieving economic security for women and families here in Georgia. We are also the anchor organization for the Georgia Coalition for Paid Leave. And that's a group of over 30 orgs based here in Georgia advocating to expand paid leave for the entire workforce. So let's talk a little bit about the lay of the land for paid leave. Paid leave allows people to care for themselves and their families, but without the stress of missing a paycheck or the inability to take time off from work without risking their job. That's why paid leave is a priority for 9 to 5 Georgia and for our coalition. We supported Georgia's only paid parental leave law, which passed as recently as 2021. That bill gave state and public school employees access to 3 weeks of paid parental leave to welcome a new child, either through birth, adoption, or foster care. We also supported removing the sunset provision on Georgia's paid sick leave law so that workers who have access to paid sick days can now use up to 5 of those sick days per year to care for another family member. This year, 9 to 5 Georgia and the Georgia Coalition for Paid Leave are pleased to support the expansion of the paid parental leave law, which doubles the time parents can take from 3 to 6 weeks. After we heard from a lot of employees throughout the state and HR offices who were confused about this or hadn't necessarily received information about the policy, our coalition went back and advocated for a notification requirement to be added to this bill, and that too was successfully passed. So 9 to 5 and the Georgia Coalition for Paid Leave, we really understand that supporting the workforce is a priority for all of us, including our state leaders. And it's a critical component of a healthy workforce. Paid leave for both parents has been shown to increase employee retention, decrease turnover, and save employers money because they don't have to rehire or retrain. Paid parental leave also overall helps boost productivity and improves morale. So for Georgia to remain in the running to be the #1 place to do business, our state must prioritize our workers, and that includes passing comprehensive paid leave policies. Beyond the workplace, paid leave is also really important for families. Paid parental leave positively affects the mental and physical health of both parents and their children. It helps increase breastfeeding rates, immunization rates, father-infant bonding, more equitable division of household labor, increased child engagement, health and development outcomes, and the whole nine. Overall, paid parental leave is also a very necessary tool to help support and increase maternal health. And we all know that Georgia really needs to prioritize and focus on maternal health. Overall, this bill helps us accomplish a lot. So we want to thank Speaker Pro Tem Jan Jones for sponsoring this legislation, and we appreciate all of the legislators who supported this bill by recognizing what a high priority paid leave is for their constituents. Over 70% of polled Georgia voters want this. They want the investment in paid sick days and paid and family and medical leave. So this isn't a partisan issue. All people are someday going to need care for themselves or have to provide care to someone else. So I want to thank y'all for being here today, and we look forward to continuing to work alongside our legislators, coalition members, and stakeholders to build the work environment Georgians deserve and increase paid leave policies. Thanks, Nicole.
All right, Jasmine, thank you so much for those words. And next up, we have Daniel Campos.
Hola, my name is Daniel, and I'm the Economic Community Organizer with Poder Latinx. I would like to thank 9 to 5 and the Coalition for giving me the opportunity to speak during this exciting press conference. As a father of 2 beautiful kids, my wife had to deliver by C-section. During the first pregnancy, I was a full-time worker, a part-time worker, and a full-time college student. Unfortunately, I wasn't provided with any type of paid leave or FMLA. As a father, all you can do is support and care for your wife and help the newborn. But how can a father do that if they have to choose between their job and caring for their spouse or newborn? I can truly understand the importance of having access to parental leave. Parental leave allows parents to take time off, work to care for their newborns, adopt or foster, typically with job protection and potentially with pay. Georgia recently passed HB 1010, extending this benefits to all state public sectors, workers, and public teachers, making it a significant step forward. While this progress is commendable, it's just the beginning. Poder Latinx celebrates this achievement, recognizing it as a positive step for Latinx teachers in the public sector. However, there's still work to be done, ensuring equitable access to paid leave for all Latinx workers. We will continue to collaborate with policymakers and advocate for comprehensive paid leave policies to benefit the entire Latinx community. The Latinx community disproportionately lacks access to paid leave, often forcing mothers to return to work shortly after giving birth due to financial instability. This dilemma leads parents to prioritize their jobs over caring for their loved ones. However, with a comprehensive paid leave policy, Latinx workers can take time off. They can care for themselves or their families. Poder Latinx remains committed to advocating for such policies to ensure that no one must choose between their health or a loved one and their job security. However, the Latinx community is not aware of what paid leave is, or as we say in Spanish, licencias pagadas. While English may be the prominent language in the US, it's imperative to acknowledge the diverse linguistic landscape shaped by immigrants. Access to resources in multiple languages, including Spanish, is crucial to ensure inclusivity. Unfortunately, the Latinx community often faces barriers with languages to access paid leave due to languages. It's time to modernize resources provision by offering support in various languages. Poder Latinx stands ready to assist and provide resources to our Latinx community in the preferred language. Here in Poder Latinx, we would like to thank and applaud Speaker Pro Temp Jane Jones and Senator Brian Strickland for being champions for a crucial policy that all Georgians and Americans need. But keep in mind, we are not done yet, and we will continue to advocate for a comprehensive paid leave policy for all workers in Georgia. This is the opportunity for all Georgians and Americans to register to vote for a champion for the care economy. Visit our webpage at poderlatinx.org, Instagram page, poder_Latinx, and come out to our community events regarding to paid leave and spread the importance of paid leave with the community, with your friends and your family. We look forward to work. Sorry. We look forward to working with our champions and finding ways to how we can work together to accomplish this important goal. Gracias por su tiempo. Thank you for your time.
All right, Daniel, thank you so much for those words. Feroza, you're up next. Feroza, let us know who you are and share a few words with us.
Thank you so much. Hi, everyone, and thanks for having me. And I want to say thank you to Daniel, especially for sharing your experiences with us. That's such a powerful illustration of why these policies are so important. But my name is Feroza Freeland. I am the Senior Policy Manager of the Southern Office at A Better Balance. We are a nonprofit organization that uses the power of the law to ensure that all working families are able to care for themselves and their loved ones without risking their economic security. And so Georgia actually was a leader in the Southern region by being one of the first Southern states to enact paid parental leave for public sector employees back in 2021, as you've heard. And since then, 5 additional Southern states have passed similar policies for their state government employees. Those states include South Carolina, Tennessee, Louisiana, Florida, and Texas. And each of these most recent policies provides a minimum of up to 6 weeks of paid parental leave, with some providing up to 8 weeks. And so I really want to applaud Georgia for bringing its policy in line with peer states across the region by doubling the number of weeks available to these public sector workers. And we know that this policy will really help Georgia's public sector, including the public schools, to remain competitive in recruiting the best and the brightest employees. And as others have mentioned, also, we want to build on this exciting progress because much work remains to ensure that all Georgia families can access the paid family and medical leave that they need. And so currently, we know that only about 1 in 5 workers in the South actually has access to paid family leave through their employers. And the Federal Family and Medical Leave Act, or FMLA, only provides unpaid leave, which many families simply cannot afford. And also, over 40% of US workers are not even covered by FMLA because of the requirements and eligibility standards. And so Georgia now has an opportunity to continue being a leader in the region by creating a comprehensive paid family and medical leave program to provide all hardworking Georgia families with at least 12 weeks of paid leave to care for a new child or for a loved one who is seriously ill, or to recover from their own serious illness. And we can learn from other states on this. So 13 states plus DC have already enacted similar comprehensive paid leave policies. And earlier this year, Virginia became the very first Southern state to pass a statewide paid family and medical leave program through their legislature. And although it was ultimately vetoed, this really indicates momentum behind expanding access to paid leave in our Southern region. And I also wanted to share that A Better Balance operates a free and confidential legal helpline. And we hear from folks, workers all across the South, who are forced to make really impossible choices and sometimes to even leave their jobs altogether because they do not have access to the paid leave that they absolutely need. And according to the Bipartisan Policy Center, over 70% of adults who are not in the labor force report that their main reasons for not being able to work are due to caregiving needs or personal health issues. And when asked, what would support them in starting or returning to work, these same individuals ranked having access to paid family and medical leave as being nearly as important as compensation in influencing their decision to return to the workforce. So I really do want to emphasize, as others have shared today, expanding access to paid family and medical leave not only benefits families, it really benefits businesses, and it would benefit Georgia's overall economy as well by keeping those with medical or caregiving needs attached to the workforce. And we know that's especially critical in today's highly competitive labor market. So just to conclude, when we're talking about paid leave, what we're really talking about is all Georgia families being able to have financial security and peace of mind during some of life's most important and often difficult moments, whether that is going through cancer treatment, caring for an aging parent, or welcoming a new child into the family. Thank you.
All right, Feroza, thank you so much for those words. We can all relate to many of those, or have family members that can definitely relate. With that, we're going to open our press conference up for Q&A. So if anybody would like to ask any questions, feel free to come off mute and ask them directly. And all right, if there are no questions at this time, thank you to the members of the media for joining us live, and for those of you who are viewing this as a recording. Thank you to the speakers for taking time out of your very busy days to schedule and discuss this topic with us. Please check the media advisory we have distributed for contact information. And if you have any additional questions or concerns, please do not hesitate to reach out. And with that, you all have a wonderful day.